So basically, doctor, now we've heard a little bit about what cerebral palsy is and how brain affected it and the different types. Could you share with us how is the diagnosis of cerebral palsy? Because from what I've read, it's actually a long process.
Yeah, it is a long process. Cerebral palsy is not. It can be an easy diagnosis, it can be a very difficult diagnosis. For example, for kids that has no, they don't have an identifiable cause. Okay, it's called idiopathic causes, where you're not sure why they become cerebral palsy. In those cases, it's quite difficult. It may take like more than a year for a doctor to come with the conclusion that this child have cerebral palsy. Normally, it starts with normal delivery, normal pregnancy, but after a few months, the parents will see, okay, the child is not developing, the child is not able to sit, and then when they notice this, then they go to the doctor with these symptoms. Okay, they have other complications as well. So when the parents start to go to the doctor, then the doctor will start the diagnosis. Okay, they will do some of the diagnosis will include doing a full history. Okay, from the pregnancy, history of pregnancy, they will ask the parents to bring in the pink book. Normally, the parents will keep the maternity, the antenatal care book, and then they will look at the records during delivery. Okay, if is it a normal delivery or is it like assisted delivery or is it cesarean? And then they will look at the blood tests that the doctors do normally in the hospitals. And after they look into the history, then they will take do a blood test, a full blood test to see is it other problems. It's not necessarily have cerebral palsy. It can be other conditions. Okay, sometimes you have genetic conditions that actually lead to cerebral palsy. So they will do that. And after they've done the blood test, they will do an imaging study. Okay, imaging study means they do X-ray, they do MRI and CT scan, where they will focus at the brain. Okay, they will look at how the brain develops and look at the areas in the brain that may be affected. So from this, then they will come to a conclusion if it is purely not a metabolic disorder. If it's probably due to the brain development, then they will come to a conclusion that this may be cerebral palsy. Okay, that is if there's no complication during pregnancy and also delivery. But if they have complications during pregnancy and during delivery, for example, a child with jaundice, for example, okay, with a very severe jaundice after delivery, the doctor may suspect that this jaundice can actually lead to cerebral palsy. So from there, the doctor will follow up the child, and then will come to a conclusion. If the damage is permanent, this means that the child has cerebral palsy. Other causes such as premature delivery, okay, or hypoxia during delivery, means the baby doesn't receive enough oxygen, for example, that can also lead to cerebral palsy. So that is a more clear-cut case.
Okay. Hearing that, something came to me.
Okay.
So how do we? There must be a few other conditions which are related to brain and affect the movement.
Yep.
So how do we basically, when we do the diagnosis, we say for exclusively that the child has cerebral palsy instead of some other condition?
Okay. How do you differentiate?
Yes.
Okay. Okay. So there are conditions like Prader-Willi syndrome. Okay, it's actually a genetic condition where a child may show some signs of problem with motor movement. They're not able to walk, they don't have gait, they have poor posture, etc. So what they will do is they will take the blood samples that they will take, they will actually screen to see whether this is other conditions that may affect the brain as well. Okay, so that is how they actually do. So the blood test is very important. The blood test is the one that they will look into other conditions that may affect they may not be cerebral palsy. Okay. Because cerebral palsy is basically a permanent damage to the brain, and it's a condition where although it's permanent, it's not progressive. Means the brain damage doesn't get worse after that. Okay. But some conditions, for example, the muscular dystrophy, for example, it is actually a progressive condition. It means the condition will get worse with time. So these are the things that doctors will exclude before making cerebral palsy diagnosis.
So basically, with cerebral palsy, we're talking about damage to the brain, and it is a permanent damage without possibility of progression.
Yeah.